Hi everyone. We get a lot of questions typically on discharge day about things that people need to do before they're safe to go home, and it can be a little bit difficult to remember, so we thought we'd put it into a video. These are the things that we need to tick off on before you go home from hospital. Now usually after surgery, if it's a straightforward bariatric surgery, most people would be going home on day one. If you're not quite right, or perhaps you live a little further away from Melbourne, then sometimes we keep you until day two. We want you to stay in hospital just the right time. Too short's bad, but too long's also no good. So the things we need to be achieving before we go home are on the board here. First of all, oral intake. In general, we want you to be aiming for about 1 litre of fluid before you're going home, so that we know you can stay hydrated safely. You've got to be moving freely around the ward. Sometimes on the first day you'll have an IV pole, so if that's the case you need to be able to carry the IV pole with you so that we know that you're also safe to move around at home. There are a few targets, we call them, people that need to be using their bladder freely and easily. You need to be passing wind, but often you won't use your bowels until you go home for a few days due to the constipatory effects of some of the medications we give you. And you'll have dressings on the first day. Sometimes they can be a little bit blood stains, and the nurses will help you change those. Once you do go home, they should be clean. You're allowed to get them wet in the shower, they're waterproof. We generally encourage you to take the dressings off at around about day 5 to 7. If you leave them on too long, the sticking adhesive makes the skin a little bit irritated. You'll get some medications to go home with. So again, this will be explained to you when you're in hospital, but almost everyone will go home on an anti-acid tablet, which you'll need to take for a variable amount of time, very important. You'll get a little bit of pain relief. Usually that is simple analgesia, including Panadol and a drug called Pentadol. And you may or may not get some anti-nausea medication depending on how you've been feeling in hospital. Obviously, we want you to take the medication if you need it, but don't take unnecessary medication. Finally, the at-home restrictions. So usually we encourage people to take a couple of weeks off work, unless you're in a very heavy job, in which case it may be a little bit longer. When you go home, you can't drive for 1 week, and we encourage you not to do any heavy lifting for a month. Obviously, you'll be seen when you're in hospital by the medical and the nursing staff, including your surgeon. So if you've got any questions, please bring them up before you go home.